Hi there, I'm Dr. Tingle, and as a ASMR doctor, I can tell you that a great night's sleep is the best thing you can do for your body, which is why I trust my nights to Manta Sleep. Manta Sleep makes the best sleep masks in the world, and with their new steam cups and cooling cups combined with their new sleep scents, you can now tailor your sleep experience every night to your heart's desire. Mix and match the scents with the cups and even different masks and have a new, relaxing sleep experience every night. Use the link below to get your mask today and use the code LETMESLEEP for 10% off. And enjoy the video. Hey there, I'm Dr. Tingle. So we have you in for a little cranial nerve exam today to address some of your ADHD sensory issues. Come on in and have a seat. Today's exam, we will be testing your sense of sight, your hearing, your sense of smell, taste, and touch. Since you do have ADHD, and I do as well, we are going to be taking this very slow and very gentle today. I will let you know exactly what I'm doing, so you don't have to feel any anxiety. This exam will be completely painless, and it should also be very relaxing for you, okay? Okay. So, to begin the exam, we are going to do a very brief face and scalp exam on you. So I'm going to have to touch you a little bit. Is that alright? Okay. So if you feel any pain or discomfort or you need a little break at any point in time, you let me know. So I'm just going to come up here, just going to gently look around your scalp, in your hair, in your forehead area. And just looking for any lumps or bumps. Anything that might look a little out of place, but don't worry. I'm not finding anything. Now, since we are going to be talking about your sensory issues today, is there anything in particular you want to address? Okay, some hearing sensitivity and some light sensitivity, okay. That's pretty common with people with ADHD. I have some hearing sensitivity myself. It's kind of annoying when you can hear electricity in the walls. It can drive you a little crazy, so I feel you. So I'm just gonna keep looking at your face here. I'm just gonna look at your forehead and just a little palpation. Good. 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 And we're gonna just look at your temples real quick again. Little palpation. Good. Little palpation. Good. And both sides. Great. Now I'm going to look at your T-zone and then under your eyes. So I'm just going to end up palpating down your nose and then running my thumbs under your eyes, okay? Any issues with that? Alright, thank you. So we're just going to gently press down the nose. Press, good. Press, good. No problems. Now under the eye. And we're just going to just gently press and rub. And press and rub. Press. Rub. Press. Rub. Press and rub. Wonderful. Any discomfort? Great. Now I'm going to just gently touch your cheeks a little bit and then work my way under your jaw. Alright, so hold still. You can close your eyes if you'd like at any point in time. And as I said, if you ever need a break or you just need a moment, you let me know. I know that it can be very tough to sit still through one of these exams, but as I said, I have ADHD too, and I know how tough it can be to try to keep present and stay focused on one thing. So if you need to let your mind drift during this exam, that's completely fine. I only need your attention for a few things. So You don't have to worry about that. Like right now, if you want to drift, feel free. I'm just going to feel under your jaw. Feel under your jaw here. Just feeling your lymph nodes back here by your jaw. Just go ahead and give me a clench real quick with your jaw. Good. That feels a little tight. You clench your jaw at night, maybe. That happens with ADHD sometimes because there can be feelings of anxiety and worry that come with ADHD, because hyperactivity does not necessarily mean physical hyperactivity. It also can mean hyperactivity of the mind, which means ruminating thoughts that kind of run away from you, being sent down spirals of negativity, which can lead to anxiety and then feelings of depression and sadness. And that's kind of things we want to help you avoid and also help you learn how to cope with and deal with, because it sucks and we don't want you to feel like that. And we also don't want you to have to lay awake at night feeling like that and not getting any sleep, because especially for ADHD people, sleep is very, very important. Alright, well, your face looks great. We will come back to that a little later during this sensation portion where we're testing your sense of touch, but we're going to start with the easy portion of the exam first, which is your sense of smell. Now, I know some scents for people with ADHD can be very triggering. I myself, and I know this is going to sound very weird, but Parmesan cheese and basil. So when people make pesto, I don't know why, but the smell makes me, oh, it's so bad. I actually have to leave the room. So if there's any scents like that will make you feel kind of icky, you let me know and we'll avoid that for this portion of the test. Alright, good. We're going to stick with some very basic ones, alright? Okay, so I just have a little bottle here, and I'm just going to ask you to close your eyes for me, and you are just going to take a little sniff, a little smell, and what do you smell? Vanilla, very good. Very good. We're going to do one more. Alright, so close your eyes again for me, and take a very little quick sniff, and we have some lavender. Very good, very good. Alright, well, seems like your sense of smell is perfectly intact, and it doesn't seem to be hypersensitive, which is great, because sometimes hypersensitivity can be very, very tough to deal with. So we're going to move on to your sense of taste now. This is going to be very quick, very simple, but like with the sense of smell test, are there any flavors that are triggering for you? Alright, so we're going to keep this again very simple as what I like to call the toothpaste flavors, since most folks are fairly okay with those. So we're going to do 2 again, and you can close those eyes and just stick out your tongue. And I'm just going to drop a little drop of this on your tongue. 1, 2, 3, and drop. And what do you taste? Peppermint, very good. Alright, and we're going to do that one more time. So close those eyes, and you let me know what you taste. Chocolate, very good. Okay, go ahead and open your eyes now. So, the sense of taste is intact, sense of smell is intact, and now we're going to look at your eyes. So a lot of people with ADHD can have sensitivity to light, sensitivity to sound, sensitivity to touch, or all three, or any combination of them. Now, do you have any of those that you'd like to let me know? A little light sensitive. I remember you mentioned that earlier. All right, so I'm going to show you two lights. I have two different pen lights here. One of them, as you can see, it's pretty bright. The other one is a little bit softer. Which one would you like me to use for the exam today? Soft one? Okay. As I said, fairly soft. So, to begin your eye exam, I just want you to look at me. I'm going to just step back for a sec. I'm going to hold this light up, and I'm just going to pass it over your eyes. Just looking for anything abnormal that sticks out. Okay, good. Good job. I know your eyes might get a little heavy during this. Personally, watching a light slowly go back and forth can be a very relaxing thing to watch. But I'm just looking for how your eyes react for now. Good. Now I'm going to do a little test on your pupils. So I'm going to use this ocular occluder, just like this on your eye. And then I'm going to take this light and I'm going to swing it in and then out so that I can see how your pupil dilates and contracts, okay? Now, you let me know if you need a break after each eye or if you're good to continue, okay? Now this is going to seem a little bright, so just bear with me. In and out, good. In and out, good. In and out, good. In and out, good. Doing okay? Alright. And let's do the same thing on the other side here. And in, out, good. In, out, good. In, out, good. Wonderful. You're doing a great job so far. Do your eyes need a little break? Make sure you blink a little bit for me. We don't want them getting dried out. And that's definitely something that happens to people with ADHD. Have you ever fallen into a little bit of a hyper-focus mode with your ADHD and found something that you were really into and you sat down or you were doing it and the next thing you know, you looked at the clock and it was like 10 hours later or 6 hours later? Yeah, and sometimes you don't blink. So hyperfocus can definitely be something that can be great with ADHD, get a lot of stuff done in a really compact amount of time. But it also can be something that can be a little detrimental. You forget to eat, forget to drink, and forget to blink. And we want to make sure that we're keeping you healthy. So we're going to continue with the eye exam now. I just want you to look at my finger here and don't follow the light. Just look at the finger. Good. Good job. Good. And same thing. Don't look at the light. Just follow the finger. Follow the finger. Good. 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 You are doing such a good job. Alright, so now I would like you to just close one eye for me if you can. And just follow this light. Good. So a little too bright? Okay. I'm just going to back it up a little bit. There we go. Good. Just follow that light with one eye. Good. Good. Alright, other eye now. Discover that. And follow. Good. Good. You're doing such a good job. There we go. Good. Alright, so let's give your eyes a little break from the light for a minute. And let's just do a little quick Snellen chart here. I'm sure you've seen these before, right? Alright, so we're just going to read down, top down. You read the letter I point to, okay? Good. 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 And this one. Great. And this one. Good. How about that? Wonderful. This one all the way down here. Great. You're doing great. You ready for the light again? Okay, good. So now I would like to take a look inside your eye, if you don't mind. So for that, I'm going to use my ophthalmoscope here. So you can see a little light, and I'm going to have to get kind of close to you. Is that alright? Alright, so what I'm going to do is I'm going to get up really close, and I'm going to use this to look inside your eye, so I can take a look at your ocular nerve, okay? Alright, so just bear with me. I'm just going to open up your eye real quick, and just take a look inside. Good, good, good. Would you mind looking up for me? Thank you. And now down, please. Thank you. To your left, please. Good. And to your right, please. Good. Wonderful. Take a look in the other eye now. So same thing. Gonna come up real close, real close, real close. And looking straight ahead, please. Good. And look to your left, please. Good. And to your right, please. Good. And up, please. And down, please. Wonderful. All right. So everything looks good on the ocular nerve there. I would like to run a few more quick eye tests with you, if you don't mind. Just to make sure that everything is working as it should. So I'm going to use a little bit of a different light now. This light actually goes on my finger like this. See? So I can go like that and then that. So what I'd like you to do is I want you to pay attention to my finger and you let me know when you can see the light and when the light goes away, okay? Alright, you ready? Here we go. Good. Good. Good job. Good. 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 Now, both eyes, I want you to follow the light. And I want you to don't pay attention to my fingers over here. They aren't important. Good. You have great focus. You are doing a great job. And I think your eyes are absolutely perfect. I would like to do one more eye test with you, which is just a little color blindness exam with Ishihara plates. So I'm sure you've seen these before. They look just like this. Yeah, you've seen these before. Alright, so we're going to start with this plate right here. Good. And how about that? Good. How about that one? Good. And this one. Very good. Let's do one more here. That one. Good. That one. Very good. Alright. So, no color blindness detected, which is fantastic. Do you want to do a little peripheral vision test with you? So this test is very simple. You're going to look right at me, and you're going to let me know when my fingers come into view like that, and when you can no longer see them, okay? Alright, so look straight at me. Good job. And here we go. Good. Good. And again, good. Good. And boom. Very good. Simple. And you did fantastic. So now we are going to move on to testing your hearing. Alright. Now before we begin this portion of the exam, do you have any hearing sensitivities that I should know about? A little sensitive to sound, okay. Are there certain sounds that get you kind of feeling a little bit triggered or a little bit just uneasy? High-pitched noise, okay, so we're not going to use the tuning fork today. I can definitely empathize with that. Anything else? Alright, so to begin this portion of the exam, we're going to start with a basic, just outer examination of your ear. If you'd like, you can close your eyes, relax. I'm not going to need you for too much during this portion of the exam. Just going to come over here and just gently inspect your ear. Just look around the outside, making sure I'm not finding anything out of place, but everything looks good so far. Look at that. Looks perfectly healthy. Okay. Alright. I'm gonna check your other ear now, alright? So same thing, just gonna inspect the ear here. Okay. Alright, everything looks good. Alright, well, those ears of yours look great. Now I'm going to take my otoscope here with the little light, and I'm going to just take a look inside of each one of your ears, okay? Alright, so you let me know if anything feels a little weird or if you need me to stop or take a break. But this should be very quick, very gentle. Just going to come over here, just lift the otoscope in very gently, and just looking inside your ear canal here, looking for any signs of impacted earwax, any inflammation, any damage to the tympanic membrane, but everything is looking very nice, very clear. Okay, good. Alright, and we're going to come over here now, same thing in the other ear. Just gonna take a look. Alright, good. Everything looks clear over here. Tympanic membrane, nice and pearly. Alright, good. The inside of your ears look great. So we're going to do a few hearing tests on you now. The first one is just going to be some sound recognition. I'm going to ask you to close your eyes. I'm going to make a sound just like this in each ear, and I just want you to let me know which ear you hear it in. You can tell me, or you can just lift a hand or a finger, okay? Alright, so close those eyes for me. And here we go. Good. Very good. Great. Good. Alright, good. Keep those eyes closed for me. We're going to do the same thing, except this time we're going to do it with words, alright? Okay, so just close those eyes, and you let me know what word you hear. Relax. Good. Sleep. Good. Dream. Good. Peace. Good. Content. Good. Blissful. Great. Alright. Open your eyes for me. I have to say that I think your hearing is perfectly intact. So we are going to move on to the final portion of the exam, which is going to be the sensation test. I'm also going to be looking at your muscles in your neck and your shoulders and taking a quick peek in your mouth. Alright? Alright, so why don't we start by taking a look inside your mouth, if you don't mind. Don't be embarrassed. It's okay. Go ahead and say ah for me. Just gonna use the nice gentle light. Take a look inside. Okay. You brushing your teeth twice a day? I know it can be hard, and ADHD people actually tend to have a tendency to have issues with oral hygiene, and it's not because they don't want to have nice teeth. It's because sometimes it can be hard to remember little things, which is why with people with ADHD, having things out in the open where they can see things can help remember them, and also helping to build good, stable routines that you know that you can accomplish on a daily basis. It's about achievable goals, realistic expectations. Remember, ADHD does not make you less, does not mean you're broken. Okay? Because if you are, then I am. And if that's the case, well, we're in this together. And let me tell you, I've survived a long time with it. It's gonna be okay. Some days are harder than others, but we get through them. And if you ever need it, anything or any help, you can always come back to Dr. Tingle. So, your mouth, on the other hand, looks fine, but try to keep up with that brushing twice a day, okay? Or at least once a day. You really don't want to get cavities. They're bad. So we're going to take a look at your neck musculature. I'm just going to feel around your neck here. Okay. Just feel around your trachea. Good. Good. No lumps, no bumps, nothing out of place, which is great. Good. Alright. Now I'm going to do a little muscular test on you. I'm going to have you shrug your shoulders up, and I'm going to try to press them down. You don't let me press them down. It's going to be a little game. Okay. Let's go ahead and shrug. And don't let me press them down. Good. One more time. Don't let me press them down. Good. Alright, relax your shoulders. Relax. We are going to do a little bit of a similar test on your face. I'm going to just gently place my hand on your face like this, and I'm going to try to push your head to the side. You're going to resist me, okay? All right, so here we go. And 1, 2, 3, push, resist, resist, resist. Good. And the other side, 1, 2, 3, push, resist, resist, resist. Good. And same thing again. 1, 2, 3, push, resist, resist, resist. Good. And same thing. 1, 2, 3, push, resist, resist, resist. Good. All right. So that's all looking fantastic. And we're going to just do a couple facial tests just to make sure everything is good on that face of yours. And this is going to be a little bit of a funny portion of the exam. So I want you to raise your eyebrows real high for me like this. Good. And now frown real big like this. Good. And now give me a big old smile. Good. And now puff your cheeks out like this. Good. And I'm going to try to pop them. Don't let me pop them. Pop, 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 pop. Good. One more time. Puff them, puff them, puff them. And don't let me pop, 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 pop. Good, good, good. All right. So we are going to move on to the final test of this exam, which is the sensation test. So this is going to be utilizing different objects to touch you on different portions of your face and your neck, and you're going to identify those objects for me, okay? Have you any skin sensitivities that I should know about? So, no cotton balls, no cotton swabs. I can definitely empathize with that one. I don't really like the way cotton feels either. And when it comes to skin sensitivity, it's not just about how, that little thing feels. It can be even clothing. I know for myself, there's certain fabrics that make my skin feel kind of like itchy. I don't like having stuff on my neck. No rings, no watches, no necklaces for me. I just don't like the way that kind of stuff feels on my skin. And you know what? That's okay. You don't have to wear rings. You don't have to wear a watch. You have to do what feels best for you and how you can feel the most comfortable in your own skin. So, aside from the little cotton swabs, anything that you don't want to be touched with. All right, good. Okay, so for the first sensation test, we are going to use a brush and this very dull metal tool. So I'm going to just, if you don't mind, I'm just going to brush your face like this. That's going to be the soft. And then this is going to be the dull. Okay? Alright, so close your eyes. And you let me know what you feel. Soft, very good. Dull. Soft, good. Dull, good. Dull. Soft, good. Dull, good. Soft. Soft again. Dull, very good. Soft, very good. You can open your eyes now. Now we are going to do that again, except that we're going to use a even softer brush and then a different dull object, okay? Alright, so close your eyes for me. And here we go. Dull, very good. Soft, good. Dull, good. Soft. Dull, good. Soft. Soft. Soft, very good. Okay, so I want to do one more sensation test on you. I have this little tube here with this little bulb on the end, and all it's going to do is spray out a little air. And I want you to just close Close your eyes, and you let me know if you can feel the little puff of air on your face, okay? Alright, so close your eyes, and good, 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 good. Very good. Great. Alright, go ahead and open those eyes for me. Well, you have passed this exam, my friend, with flying colors. And there's not anything wrong with you. Though I can definitely see that you do have some sensory issues related to your ADHD. And that's perfectly okay. There's things that we can do to help you mitigate those issues and the situations you might find yourself in when it comes to light sensitivity, blue blocking sunglasses, sunglasses in general, polarized lenses, even hats. When it comes to your auditory sensitivity, headphones, noise canceling headphones, earplugs are your best friend. And when it comes to the smell, well, there are nose plugs and nose clips, but no one wants to walk around with those. And it can be a little difficult, but sometimes we just kind of have to tough it out, which I know no one likes to hear that, but it's true. But if you ever need help, or you ever want someone to talk with about your ADHD, you can always come back to me, and I will gladly listen. But for now, I'd like you to go home, take the rest of the night to just relax, get in some comfy clothes, put on your favorite comfort show, you know, the one you've watched about 15 times by now, and just cuddle up and enjoy the night and get a great night's sleep. And don't forget to hydrate. All right. So schedule your next appointment at the front desk on your way out, and we will see you again soon. Bye-bye.